And hello, everybody, or bonjour, as Bruno usually says. This is Shahir Sheikh, and I am back with Bruno Larvol for the Larval Oncology podcast. And this is episode 38. We've done quite a few now. So thank you very much for joining us again, Bruno. This one's actually going to be a very interesting one because we are literally competing with something that's actually very familiar to everybody out there these days. Uh, Thank you for joining us again, Bruno. How are you doing?
Oh, I'm doing well. So this is going to be fun. We're gonna compare what LARVOL CLIN knows about a trial and what our friend Eva is the name I gave to my conversational ChatGPT, has to say, and we'll see if they'll keep each other honest. So we'll see how that works.
We'll see if it's ready for the challenge or not.
Yes, 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 yes. It's we're talking about one trial that has been in the news the last couple of weeks, I think, right? The Libretto study from Lilly, Libretto, which one? 432,
432.
right? So before that, in case you don't know us or our platform, so LARVOL CLIN is essentially the Google map of clinical cancer data. So all the publicly available data is gathered, curated, organized, put into a common data model. We aim to be the ground truth, the verified public data about cancer trials. And I guess so does our friend Eva, the conversational chat GPT. And so we're going to compare who knows what. But first, I have to say something about conversational AI. Um, I love talking. That's why we have a podcast, I guess, more than typing. And so when I talk with AI, I love to use conversational. And I have to say, I don't necessarily love OpenAI versus Claude versus, versus Gemini versus Grok versus, but I I have to say that OpenAI conversational mode, live mode, is better than anything else in the conversational mode. Claude it's terrible. Claude, you cannot talk. You have to press a button. Gemini is okay, and Grok is too quirky for me and is not as good in general. As much as you know, I like Elon Musk. So we're gonna see. So I named Eva here. Let's see here. So we're gonna talk about that clinical trial in just a second. All right, and compare it. So
As you do that, I'd like to inform my audience, our audience, that there was a very detailed survey from Claude, from Anthropic, in my email inbox today, and all they wanted to know about was their conversational model. How's that working? How is it? How easy is it to use on the mobile phone?
it's terrible.
And
It's terrible. It's not
I told them
conversational.
that.
I
I
was
told
at a
them that.
meetup. Someone said it's conversational. There's nothing conversational about Claude. That may be the best model, but you cannot talk. You have
That's
to. It's the walkie-talkie. You have to press a button. That's
it's
not
a little
conversational.
harsh, or should we say, OpenAI like spoiled our expectations, maybe, but it's a little harsh
It's
to say that it's not
completely
conversational.
different. It's not. It's like completely different. They're not competing at all. In conversational, I talk and I interrupt. Right? It's not a walkie-talkie. You have to press a button and then it's their turn. Completely different. So I told people, well, it's not conversational. They say, yes, it is. I said, no, it is not. I obviously have a strong opinion about conversational AI. Anyway,
I mean,
it,
you've been very, very familiar with all of these models because of the amount that we're spending with them. So I put a lot of weight in your opinion about this, of course, and I'm sure that if any's one of our audience is from Anthropic and is listening to us and would like to know more about our experience, we'd
yes,
be happy to talk. We might find some time.
that's right. Exactly.
So
Actually,
I'll.
uh, Anthropic just said they had a $50,000 grant in token, and we might apply to that. And in bonus, we'll tell them what we think really about their conversational AI.
Oh yeah, we'd love to. So without so because we time is very limited for us on this one, I'll jump onto the main topic that the audience is waiting for, and I'll switch on the screen share as well, and we will see what exactly Clin has for us.
So, and as you open the libretto, I'm going to ask Eva here. So, hey, Eva, tell us what you know about the Eli Lilly trial Libretto 432, Libretto 432, and about the most recent data from Libretto 432. So earlier we asked the endpoint.
The Libretto 432 trial focused on early stage RET fusion positive lung cancer showed that patients receiving sulpercatinib after surgery had a dramatic reduction in risk of recurrence or death, about 83%. After 2 years, 92 to 94% of those on sulpercatinib had no event, compared to 61 to 70%.
Let me interrupt. So first, what's the endpoint for that trial? And what is the experimental versus control? And if you don't mind, so you show the screen as we speak.
Event-free survival, which in this adjuvant setting means the time until recurrence or a related event. The experimental arm was sulpercatinib, a targeted RET inhibitor, and the control was a placebo. So they were comparing sulpercatinib against no active treatment after surgery.
And I couldn't hear because I was talking over you. What again is the endpoint?
The endpoint is event-free survival. In other words, they measured the time until recurrence, progression, or death after treatment.
Okay. And why is it event-free survival and not progression-free survival? I'm going to test her.
That's because in the adjuvant setting, patients have already undergone surgery or definitive treatment with curative intent. So we're not just tracking tumor progression. We're measuring any event, like recurrence, a second cancer, or death, because the aim is to remain event-free after curative treatment.
Okay. And so is there a median in the event-free survival that was detected? Do you have median values for that trial?
In that trial, the median event-free survival for the sulpercatinib group wasn't reached yet because
you got everything right.
Remained event-free. For the placebo group, the median event-free survival was around 31.8 months.
Oh, well, now that you got wrong. Let's look at it. The placebo doesn't reach 50% either. Were there several subgroups in that trial?
Yes, there were other clinical factors. But the key takeaway is that the event-free survival benefit was consistent across subgroups. If you need specific subgroup details, we can dig further, but the broad pattern held steady.
So in the data we're looking at, the placebo arm doesn't cross a 50%. So there seems to be a disconnect between your data and the data we have from ASCO 2026.
I hear you. It sounds like the data we referenced may have been from an earlier or slightly different analysis. If you have the most recent ASCO numbers, trust those. Clinical data evolves, and it's key to go with the latest. Let me know if you want help interpreting what you're seeing
Well,
now.
can you try to find the exact source of the data that indicate that placebo crossed 50%? Because that's very important. So we don't know if it mixed trials.
At ASCO 2026, the Libretto 432 trial data showed that for patients with stage 2 to 3A RET fusion positive lung cancer, the 2-year event-free survival was about 91.5% with sulpercatinib, compared to about 61.1% on placebo. In the broader group covering stage IB to 3A, it was about 94% versus 70%. The placebo arm did cross below 50% by around 31.8 months, highlighting a clear benefit with treatment.
Okay, it's not bad. It would take a good amount of effort, which we don't want with the whole audience, to know whether it's perfect or not, but it's pretty good. What's interesting, Shaheer, that before we started live in the podcast, we actually did the same query, and it got wrong a number of things. So ChatGPT thought that the endpoint, for example, was PFS instead of
Mm.
EFS, despite being questioned and pushed back on that. It thought that was the case. So what I tell people is that if I talk with someone, even an expert, I always expect 20% what they say to be hallucination or wrong. So I guess why wouldn't we expect the same from an LLM?
That seems like a valid argument, Bruno. Um, we, by the way, there's I know that we are on clin.larval.com, and we have a lot of other angles as well. And I understand that I mean, it did mention that the data keeps evolving, and of course, that's the strength that we are having with Larval Clin. Of course, we make sure that everything is up to date for all the users, and yeah, we're working around the clock to ensure that. Um, Along with that, the X posts are sometimes helpful as well. So we can also see with your help, Bruno, that there's a lot of people talking about the trial itself. So there's comments from multiple doctors, and they're not. So you see how nicely it's a strong positive on the top, then it follows with a neutral, and then it's a negative. So uh, there it basically means that the data is probably not has not been stable.
So continue to go down. I'm trying to look especially at the negative because often uh, the interesting things is in the negative. But I don't fully understand the comment from Dr. Yanmaz. So go down to see if there's another negative comment. I see, of course, famous people like Dr. Choueiri, Dr. Liu, um, commenting
Dr.
positively
Liu,
on the
yeah,
hazard
yeah,
ratio. Dr. Liu again. So overall, the commentary is very positive across the oncologists
that is
here.
true. As we're scrolling down, it's coming out more and more
Dr.
positive.
Mercade.
Actually, plenty of strong positives.
Yeah, so I would say overall, this is a very positive results. Go back to the analytics for a second. Go back to the at the top of that page to the different analytics. So
Okay.
our system consider that trial to be practice changing. Uh, Although I thought practice changing was when the value was above 75%.
So let me clarify one thing quickly. This is still this analytic in particular is still a work in progress, and there's calibration on the site. So it's debatable if it's practice changing or not, but
Well,
certainly
but
is practice informing.
I appreciate you're saying that, but um, I will pass that to the team. We're bidding in public here, by the way. So when we found a problem, we don't hide it. So our algorithm, our AI, is giving every trial a score, which we call an impact score. That impact score is derived from all the commentaries from the oncologists, and this is an explanation of what it is. Where did you
Impact
click to
score.
get that, by the way? What?
Oh,
Oh,
it's
here.
right here.
Okay, okay. So normally, my understanding was that practice changing when it was higher than 75%, and from 50% to 75, it was practice informing. So let's check that with our team. There's a bit of disconnect there. Um, so, but by the way, I think that the bug is that it is practice changing, and the number somehow did not um update because when I look at the number of dark green on the most
Yep.
recent bar, that's a practice changing trial signature, right?
Certainly
Uh,
looks like one.
Absolutely. 70% are positive. There was one negative, and it could even be an artifact, right? The AI sometimes misclassifies a sentiment very easily, um, occasionally. So this is a practice-changing trial. And if you go back to the commentary from Dr. Choueiri, let's go back to that was Dr. Choueiri or Dr. Liu, who are two, of course, prominent KOL say shows substantial EFS adjuvant. Yeah, okay. Practice changing data according to Dr. Flores. What does Dr. Liu says? Uh, uh, well, it is not very clear. Let's see. Next one. A is as expected most common. Rate of continuation. Overall, fits the expectation paradigm set by Adora and Alina and sets. Go back to the new standard. New standard of care means practice changing. So, uh, and the next comment, from Dr. Callis, comprehensible um, practice changing. So there is a strong practice changing message from
Hmm.
KOLs. So our system should classify it as a practice changing. I suspect that the score itself somehow did not update. So we can check that.
We'll check that, and as always, we'll keep the audience posted of any updates. Um, as we go towards the end, Bruno, I would like to mention that we would love to help you out if you're interested with in Larval Clin. We usually have Bruno giving away a ton of free access to the platform. So we'd be happy to look into your request as well. And we appreciate you for tuning in today to see the standoff with GPT and Clint. It was
And
actually C versus C, ChatGPT
yeah,
versus
yeah, yeah,
Larval
yeah.
with Clint.
Uh,
Clint.
so
Larval.
next week we'll do the podcast from India because I'll be traveling, right? And the following from France, and the
That
following
is
week from New York. I'm here in San Francisco today before a long travel.
happy journey, Bruno.
Thank you.
So we will be seeing you all again from India and from San Francisco right now, as we're seeing you, and from France in a few days. So please keep tuning in and keep supporting us. Thank you very much, everybody, for tuning in.
Thank you.